I just had a kind of a revolving door, and it became generational, of seeing children who had, adverse effects of substance use disorder from our community, within our community. I just wanted to become part of the solution, and I knew I needed to probably tackle that at the level of helping individuals find recovery. The coolest thing to me was people or organizations that had generally been very segmented. We all came together for this focus, and it was really neat to see in the middle of COVID. I don't know if it made people's hearts a little bigger, but we knew that this grant was exactly designed for Toombs County, Georgia, and it has just blossomed into something that I'm so proud of. Craig George and Jimbo Parton have been just amazing. They have gotten their forensic peer specialist certification, and they are going into the jails. And when inmates are released, they are given Narcan upon their release, and I think we're the second county in Georgia to be able to offer that for individuals leaving the jail. The behavioral health specialists that are working in the police department, they go and offer behavioral health services in the jail as well.
Starting with implementation, we were able to partner with our police departments. We have 2 in our county, so there's the Lyons Police Department and then the Vidalia Police Department. We were able to equip all the officers within the 2 and the Sheriff's Department with Narcan and train them. So that was a huge accomplishment.
We now have a recovery community organization that's standalone from the grant funds, and we have individuals that can come in and get, cleaned up, get a shower for an interview, or wash their clothes, whatever they need, as well as get some peer support services. One of the biggest efforts that I think we've done is try to bring diversity into our team. We've had subcommittees. One of those subcommittees is a minority subcommittee. And that has been really cool because they know what they need, and we're able to kind of think about how we can address those needs and reach out further in communities that we normally would not have come actually in the clinic. Another big population of people that's very underserved in our community is the migrant farm workers, and so we've got some folks that are going out and passing out brochures and bulletins. We're also leveraging what we do in the after-school programs with a youth advisory council that tells us what they need.
We started prevention in the schools. So with that prevention program, we offer it within the after-school program. And we use a curriculum that is age-based as far as elementary, middle school age groups. Individuals who did not have insurance or a means to pay, we were able to see them at no cost. So it really opened the doors for individuals who were not getting help because of the lack of means to be able to come and get help. It is amazing to see individuals get their families back and be able to have their, be around their children again. And I think the goal was to restore families, and we're seeing that firsthand, and it's amazing. I can remember when we first started, and and the individuals would come in, and you could just see a fog, and then within 6 months of being able to get help, and then a year later, and then to see them in the community giving back, and see it come full circle I think that's the most fulfilling part.